So, David, let's dive straight in. RFK Jr.'s confirmation hearings. What a spectacle. Watching the Senate grill him was, well, illuminating, though maybe not in the way he might have hoped. It became clear really quickly that his understanding of some critical public health policies is, let's just call it surface level.
Oh, that bad? I know that Dr. Swanson, how creates and edits these episodes, listen to KFF Health News' podcast, What the Health, episode titled RFK Jr. in the Hot Seat, to prepare for this episode. And we, as your AI hosts, relied on it as well. Thanks to Sandhya Raman of CQ Roll Call, Sarah Carlin Smith of The Pink Sheet, and KFF Health News' Julie Rovner for their insightful conversation on this topic. We'll provide a link in the episode descriptions. What stood out for you, Sophia?
Well, for starters, RFK Jr.'s lack of knowledge about Medicare and Medicaid. Between those two programs, more than 100 million Americans are covered. But when asked fairly straightforward questions, RFK Jr. fumbled. Senator Hassan specifically pressed him, twice, about matters under the CMS umbrella, like emergency care mandates and Medicaid rules, and he, well, frankly, had no clue. It was awkward.
Awkward is the word. I mean, how does someone get put up for this position and not know the basics? Was this not like Prep 101 for his confirmation?
Right? That's what's baffling. Julie Rovner from KFF Health News even called him, and I quote, the least knowledgeable nominee she's seen for HHS secretary in nearly 2 decades of watching these hearings. And what's more troubling, David, is that this lack of preparation reflects poorly on how seriously he or his team takes this responsibility. For example, Medicare and Medicaid are lifelines for millions of Americans, and if a leader in HHS doesn't grasp these programs, it risks eroding public trust.
Yikes. That's pretty harsh, but it sounds like it's deserved. Okay, what about his views on vaccines? I mean, that's got to be a contentious topic, given, well, everything.
Oh, absolutely. Vaccines were a huge point of contention. Senator Bill Cassidy, who, by the way, is both a doctor and a Republican, called out Kennedy's long history of controversial statements. At one point, Cassidy recounted a very personal story about losing a young patient to a preventable disease because she wasn't vaccinated. That set the stage for some direct and frankly pretty scathing questioning about Kennedy's rhetoric on vaccines.
Wait, what? That's heartbreaking. And it sounds like Kennedy didn't exactly smooth things over?
Not even close. Cassidy gave him repeated opportunities to explain or walk back some of his vaccine comments, but Kennedy's responses missed the mark. Instead of showing he'd thought critically about these issues, he just doubled down. And honestly, that performance might have tanked his chances of securing the necessary Republican votes.
Okay, so we're looking at a nominee with questionable expertise on core health programs and polarizing health policy views. Should we talk about what this means for public confidence? Because right now it sounds like we're in dangerous waters with someone like him.
Exactly. That's the real core concern. It's one thing to have a political stance. It's another to lack fundamental knowledge of the role you're stepping into. Senators across the aisle recognize that HHS is too critical an institution to be led by someone unprepared. Kennedy's glare of gaps, from mistruths about vaccine safety to conflating prescription drug deaths with other fatal events, makes it really hard to imagine this instilling confidence in healthcare policy leadership.
You've got to wonder how much of this was actually rehearsed beforehand. And if this was the practiced version, I can't imagine how he'd sound unfiltered.
Right? That's a sobering thought.
Sophia, after everything we've unpacked, it's hard not to focus on the negatives. But let me ask, despite all the missteps, is there anything about RFK Jr. that could actually challenge the system in a way that might, I don't know, work to our benefit?
That's a fair question, David. And yeah, while there are plenty of concerns, there's also an opportunity here, especially when you look at how he's positioned himself as someone willing to challenge vested interests. For example, Kennedy has been outspoken against pharmaceutical and food industry practices that worsen chronic diseases and environmental health hazards. That kind of criticism, if it's directed well, could amplify much-needed conversations about corporate accountability in public health.
Okay, so he's kind of this outsider voice railing against big corporations. But bear with me here. Doesn't that ring hollow when his scientific credibility is, let's just say, shaky?
It's a valid point. But sometimes an outsider, even a polarizing one, can catalyze transformational change in ways insiders might not. Look at the history of healthcare innovations. Often, disruption comes from unlikely figures. Take, for instance, early pioneers like Mary Lasker, who lobbied relentlessly to put cancer research front and center during the 1940s. She wasn't a scientist, but she reshaped the research landscape by challenging traditional funding structures. Could Kennedy channel that same spirit?
That's an interesting comparison. Do you really think his maverick tendencies could translate into something productive for, like, overhauling systemic inefficiencies?
Potentially, sure, if he surrounds himself with real experts and builds a team willing to engage with science instead of undermining it. Think about things like the way he's criticized regulatory capture. The idea that agencies like the FDA are sometimes too cozy with the industries they regulate. We know these concerns aren't baseless. If his pushback on entrenched systems leads to stronger safeguards or more accountability, that'd be a win in my book.
Okay, but let's be real here for a second. This is the same guy making wild claims about vaccines and prescription drugs. How do we square that with being, hopeful?
We don't gloss over it, that's for sure. His anti-science claims are deeply concerning and downright harmful in public health contexts. But his willingness to challenge status quo practices, well, that could potentially disrupt harmful cycles, especially in areas where corporate interests overshadow public health priorities. It's not an endorsement per se, but it's recognizing there's a nuance there. The system does need disruption, just not at the expense of evidence-based policy.
So, cautiously optimistic but still nervous?
Exactly. If, and that's a big if, he can focus on evidence-based reforms instead of misinformation, there's a chance his outsider mindset could bring about some necessary conversations.
All right, I'll admit, I can see the argument for why we shouldn't completely write him off. But let's be honest, can he actually pull it off? Or is this just wishful thinking?
Well, that's the question, isn't it? David, speaking of systemic challenges, this recent funding freeze has thrown federal health agencies into complete chaos. The Office of Management and Budget's sudden halt on grants and loans has effectively put programs at the NIH, CDC, FDA, and beyond on, well, pause.
Wait, pause how? Like, completely stopped in their tracks?
Pretty much. Scientists couldn't travel, grantees couldn't access payments, even Medicaid portals went offline in some states. It was meant to preserve funding integrity, at least officially, but the rollout was so rushed and vague that it caused total confusion. And then, when a judge stepped in to block the freeze, the administration barely retracted before doubling down with more exclusions. It is, a legal and logistical mess.
Wow, okay. So how does this even happen? I mean, doesn't the government have processes to avoid something like this being, a nightmare for everyone?
In theory, yes, but in practice, it's clear that this was poorly coordinated. Healthcare programs don't operate in silos. They're interconnected across systems. Freezing federal funding without clear guidance ripples everywhere. For example, community health clinics relying on grants were suddenly in limbo. And then there's the so-called chilling effect. Even if the rules were clarified later, the damage was already done. Fearful of non-compliance, some organizations overcorrected and halted important work.
It's like they tossed a grenade into the room just to see what happens. Kind of reckless, right?
That's one way to put it. Critics argue the point wasn't about funding integrity at all. It was about creating confusion and forcing programs to scale back in ways that align with narrower political agendas. But in the process, essential services were disrupted, leaving vulnerable populations in precarious situations.
Speaking of vulnerable populations, can we jump to the immigration stuff? Allowing ICE raids in hospitals? That sounds like playing roulette with public health, doesn't it?
Exactly, David. Hospitals are supposed to be safe spaces. But under these new policies, ICE officers can detain people in settings where they should feel secure enough to seek care. Think about farm workers, many of whom may lack legal status here. If they fear deportation, they might avoid getting tested for, let's say, bird flu or other contagious conditions. That puts their health and the public's health at risk.
It's like creating a perfect storm, right? People don't go to the doctor because they're scared. And then whatever disease they have spreads even further.
Exactly. And don't forget, it's not just infectious diseases we're talking about. Chronic illnesses, pregnancy complications, routine vaccinations, all of those vital treatments are at stake. And when fear keeps people away from care, the knock-on effects on the system as a whole can be tremendous. A single policy like this reverberates far beyond immigration enforcement.
So the logic is, what? Enforce the law even if it means risking a public health crisis?
Well, yeah, that's essentially the justification. Supporters of these policies argue they prioritize border security and deter illegal immigration. But the trade-off is enormous. Sacrificing public health to push a broader enforcement agenda undermines so many of the core principles of a functioning healthcare system.
Man, it's wild how health and policy can get so tangled up. All at the expense of actual people's lives, you know?
It's a stark reminder of how fragile the system can be when policy shifts disrupt its foundations. You know, David, speaking of how fragile systems can unravel under abrupt policy shifts, let's look at HHS right now. They're facing a perfect storm. Significant policy upheavals, no Senate-confirmed leadership, anxious staff, and funding stops. It's practically a case study in how instability magnifies systemic dysfunction.
Yeah, it's pretty wild. I mean, it sounds like working in that environment must feel like being on a ship in the middle of a storm without a captain. What does that mean for, the day-to-day operations over there?
Great analogy, David. Think about this. HHS oversees programs that millions of Americans rely on: Medicare, Medicaid, emergency health initiatives. When internal chaos hits, even minor disruptions can ripple out to the delivery of essential care. For example, the recent funding freeze left staff unsure which programs were even operational, and we're already seeing federal workers second-guessing their actions, afraid they might inadvertently overstep vague new directives.
It's like everyone's playing defense instead of keeping focus on their actual work. But what's driving this instability? Is it a leadership issue or something bigger?
Oh, it's definitely both. The lack of confirmed leadership creates a vacuum. But there's also something more systemic at play. You see, complex institutions like HHS operate within intricate interdependencies. Systems theory tells us that when these connections are disrupted, especially through unclear policies or abrupt changes, the system struggles to function efficiently. Feedback loops break down, decisions get delayed, and the overall mission falters.
That actually reminds me of something from the tech world. When there's a major systems outage at, say, a global corporation, leadership clarity can mean the difference between bouncing back in hours or, spiraling into chaos. But here at HHS, it sounds like there's no one steering the ship, or even patching leaks.
Exactly. And here's the kicker. Healthcare ecosystems are so much more fragile than tech systems. When you're dealing with lives, rather than business operations, the stakes are exponentially higher. A single policy mishap, like mismanaged funding freezes, doesn't just delay projects. It jeopardizes care for some of our most vulnerable communities.
Okay, so let's say you're the acting head of HHS for a day. What would you prioritize to stabilize things?
Oof, where do I start? First, I'd focus on reestablishing trust and clarity. That means clear communication channels for staff and reinstating predictable workflows. Then bolster cross-agency collaboration. Systems thrive on reliable interconnectivity. Lastly, bring in transparency. People rally around leadership that's consistent and honest, especially in uncertainty.
That makes so much sense. And honestly, it seems like industries outside of healthcare could learn a lot from this kind of approach too.
True. Cross-sector learning, like borrowing systems management ideas from tech or crisis strategies from disaster response, could serve healthcare well. But the key is proactive leadership that integrates those ideas in real time, not after the fact.
But that's tricky when leadership is, not really there, right?
Exactly. And without leadership, the system's flaws just keep compounding.
You know, Sophia, hearing all this about leadership gaps and these systems compounding flaws, it kind of makes you wonder, what can the average person even do when faced with something so massively out of their control?
David, that's such a relatable feeling, but it's not the whole story. Sure, policies and leadership are critical, but there's so much we can do as individuals and communities. Change doesn't always have to start at the top. It can bloom from the ground up, too.
All right, I'm intrigued. What does blooming from the ground up look like? Give me something actionable here, Sophia.
Okay, let's break it down. First, personal behaviors, things we have direct control over. Think diet, exercise, sleep. These are small but incredibly impactful steps. If we prioritize our health, we create ripples, not just for ourselves, but for the people around us. Revolutionary? Maybe not. Effective? Absolutely.
Huh. Kind of like those ripple effects from when someone starts going to the gym and suddenly their friends are asking them for workout tips.
Exactly. Health habits can spread socially like any other behavior. But beyond personal action, let's talk about something equally, if not more, important: community engagement. Getting involved and organizing locally can have transformative effects. Community gardens, fitness groups, mental health workshops, these build healthier environments and stronger connections.
You're saying building healthier communities starts with, well, building community makes sense. But what about bigger changes? You mentioned education earlier.
Yes, because education is at the heart of so many public health outcomes. Health literacy, knowing how the system works, understanding prevention, accessing resources, is life-changing. So advocating for stronger health education in schools, or even volunteering to teach others, empowers people to navigate healthcare better.
Okay, so let me get this straight. Step 1, take care of yourself. Step 2, connect with your neighbors. Step 3, educate yourself and others. Got it. But what happens if none of this feels like it's making a dent in the system?
That's where patience and persistence come in, David. Real change takes time. Even small acts of engagement, voting in local elections, attending public forums, supporting transparent policies, add up. Plus, when individuals and communities come together, they amplify each other. It's like collective micro-changes driving macro shifts over time.
So the big takeaway is, don't wait for the system to change from the top down?
Exactly. Start where you are with what you have. Transforming the healthcare system isn't just up to policymakers. It's something we can all contribute to every day.
All right, Sophia, you've sold me. That's a great note to end on. Anything else? Or are we calling it a wrap?
Just one thing. Remember, the system may be complex and daunting, but people power matters. Every step, no matter how small, contributes to the push for a better, healthier tomorrow.
On that note, we'll see you all next time. Thanks for tuning in.